Hello everyone. Welcome to Study Nursing by Sense Schools. Today in this video, we are discussing about respiratory disorder, which is asthma. So in this video, we will discuss about the definition of the disease, pathophysiology, that is what causes, what exactly takes place when you have this condition. So what is the pathology behind this disease? We'll also learn about the etiology or causes of asthma, the clinical manifestations, diagnosis and assessment of asthma, how we manage medically as well as pharmacologically the disease condition, and most importantly, the nursing management. And since this is a disease which is highly controlled or prevented by taking necessary actions, we'll learn about the community teaching for the patients. So these are the topics which is discussed in this video. Before we go ahead, let me also recommend to you a couple of associated videos we have made on asthma that includes nursing diagnosis, detailed nursing care plans, and also common drugs used in asthma. So when you see this video, make sure that you go ahead and have a look at the other topics as well, so that you feel much confident, much knowledgeably resourceful person. All right. So this is the intention of the video, and make sure that you see this video, you watch this video multiple times, so that you get a deeper idea or a deeper knowledge about this disease condition. All right. So with that, let's move on to the definition of a disease. So by definition, it is a chronic inflammatory disease of airways characterized by hyperresponsiveness, mucosal edema, and mucus production. Let's dig deeper into the pathophysiology. So when we have a triggering factor for asthma, we learn about triggering factor in the coming slides, that causes airway inflammation, and this airway inflammation is preceded by hyposecretion of mucus, airway muscles contraction, and swelling in the bronchial membrane. All of this causes narrowing of the breathing passages, and when you have the narrowed passage, you have the wheezing. All right, and then you develop cough, which may be with or without mucus, and also dyspnea, which we otherwise call as shortness of breath. All right, so this is what the pathology would look like. The risk factors for asthma include family history, and most importantly, any allergy being the strongest factor or etiology for asthma, and also chronic exposure to airway irritants or allergens. These allergens or irritants may be grass, weed, pollen, mold, dust, or even animal fur. All right. So these are the risk factors for asthma. What would be the triggering factors? So we remember, you have seen in the slide that describes pathology. We have put across a triggering factor, right? So what could be the triggering factors? The common triggers for asthma symptoms and exacerbations include airway irritants, and they could be pollutants, cold, heat, strong odors, smoke, or even perfumes. And sometimes, in some cases, even exercise can cause the triggers, even stress or emotional upset can cause the triggers, and sometimes any medications or infections. So, what could be the infections or medications? I would say, in case of rhinosinusitis with post nasal drip, medications, and then viral respiratory tract infections, or even GERD or gastroesophageal reflux disease. So these could be the triggering factors for asthma. All right, so let's move to the next slide that describes the signs and symptoms. So before we discuss the signs and symptoms, it's very important to know that it depends on the severity of asthma presented. So suppose you are a nurse or a student nurse or even a health worker who aspire to become a nurse. All right, and you are dealing with a patient diagnosed with asthma. It could be the ICU, it could be the ward setting, or it could be even the community. So that implies that the disease could be presented in any of the varying severity. So if the signs and symptoms, we are discussing the very signs and symptoms here, so the presentation depends on the severity of the disease. So let's see what are the clinical manifestation you can see in the patient. So to begin with, let me tell you, there is a classical triad. All right, the classic triad for asthma is three things, that is cough, dyspnea, wheezing. So cough, dyspnea, wheezing is a classic triad which is observed in almost all the asthmatic condition presented. The most common symptoms of asthma are cough, that could be with or without the mucus production. You could have dyspnea or breathing difficulty, and wheezing. So when we talk about wheezing, it could be first on expiration and then possibly during an inspiration as well. So asthma attacks, when do they take place? This mostly occur during the night or even in the early morning hours. All right, and asthma exacerbation is frequently preceded by increasing symptoms over the days, but it may begin abruptly. So it's not necessary that you can have asthma all of a sudden. It could develop all of a sudden, or it could develop over a couple of periods of time. But during those times, you have that symptoms on and off, or maybe continuous in mild severity, if you know what I mean. All right, then chest tightness. It could be observed because of the back-to-back dyspnea and also the clinical things which are going on. You can have, the patients can have chest tightness during asthma. The expiration requires effort, and the expiration becomes prolonged. An exacerbation, as the exacerbation is progressing, central cyanosis secondary to severe hypoxia may be occurring. So central cyanosis could be observed in the patients. In addition, you could have, or the patient could have, the diaphoresis, which is sweating, and they can have tachycardia or increased heart rate, and also a widened pulse pressure. And again, when it comes to exercise induced asthma, so when it comes to exercise induced asthma, you could have the choking sensation during the exercise. All right, and in severe condition, they can develop status asthmaticus. I'll also try to make a video on status asthmaticus and its management. But for you to know, it's a life-threatening complication, and it could be the complication of asthma. So, in addition to all these signs and symptoms discussed, let's also talk about the associating clinical manifestation. We have already discussed about the allergic reaction, isn't it? So, when the patient has the contact with an allergens and they develop asthma, along with that, they could also be presenting to you with eczema or rashes or even temporary edema. All right, so these are the signs and symptoms combined. All right, so I hope you are clear until here. So in this slide, we discuss about the assessment and diagnosis of the disease. So when you take the history of the patient, or when the doctors take the history of patients, it is going to be a very detailed history that includes the family history, environmental, socio-economical, and financial history. Why I say socioeconomic history is, sometimes if they can't afford a good housing, that could also mean their house has mold infestation or any of the allergens present in the house, poor hygiene, etc. Isn't it? And also, when we talk about occupational history taking, they could have been individuals who worked in factories that includes, exposure to the chemicals, exposure to the respiratory irritants. We have already discussed about the respiratory irritants. If you don't remember, go back and watch the video again so that you get an idea. All right, so back to the topic. So we take a detailed history of occupational, environmental, family, and socioeconomic socioeconomic history. And also, when the patient presents to us in a clinic or a hospital setting, we take a detailed assessment or diagnosis measure by checking their ABG, arterial blood gases, the sputum test, all right, the blood test, pulse oximetry, and also pulmonary function tests such as pulmonary expiratory volume, FEV, and also tests such as FVC, which is forced vital capacity. We also do spirometry, as well as we also do the peak flow meter, so to assess and to obtain a baseline data. And also we ask the patient to continue to do peak flow, and we set up a common target. We set a target for the patient so that we know whether they are improving in the lung capacity, etc. All right, so these are the diagnosis or assessment involved in asthma. I hope it is clear to you. We'll move on to the next management, which is very vital. It is a medical management. In here, we discuss about the pharmacological therapy. So, if you are somebody who's preparing for a test or anything, you can learn one thing for sure. It is a drug of choice. The drug of choice for asthma is albuterol. So, yes, talking about the pharmacological therapy, there are two classes of medication used in asthma. One is long acting control, and the second is a quick relief medication. All right. So let's talk about the quick relief medication. When it comes to the asthmatic attack, there are certain medications which is recommended for a quick use. So albuterol or short acting beta 2 adrenergic agonist are the classification of medication which is recommended for the short acting or the quick relief medication. So what are the other medicines that you have seen in this category? So short acting beta 2 adrenergic agonist also includes levodopa as well as a terbutaline. You might have seen nebulizations which has a terbutaline name. You might also have seen inhalers with terbutalins in it. So these are the short acting or the quickly acting medications. All right, and then we have anticholinergic that dries up the the lung and the mucous membrane, as you have learned already that it causes the excessive secretions or hyperresponsiveness of the mucous membrane. So anticholinergics dries up the lung system, which improves their breathing pattern. Ipratropium is a common drug which you could see in your hospital setting or a community setting, or even in the ICUs, which we normally give in the nebulization form. You also have the same drug in the inhalation form as well. I have done. By this time you watch the video, I don't know if that video could be released or not, but make sure that you learn about ipratropium in the drug study playlist that we have in the video. All right, so anticholinergic is also used in the pharmacological therapy of asthma. And next we have the steroids and corticosteroids. So when we talk about corticosteroids, you might have heard about MDIs or metered dose inhaler. So corticosteroids are the contents of it. Along with that, when we talk about steroids, it could be IV or oral steroids. But if you see asthma in an ICU setting, in a critical care setting, it could usually be an IV steroid. But otherwise, in almost all the circumstances, especially when the patient is admitted to the ward or even in the community setting, they could also undergo a short-term steroid therapy, or even long-term to just to prevent the disease. But due to the complications or the of the long-term usage of steroid, mostly it is a short-term therapy every time they have the exacerbation of disease. All right, so there is a correction in it. The steroids are given in short term to control the diseases, whereas the corticosteroids, it could be used as an inhaler. All right, so in steroid, we talk about the IV steroid as well as the oral steroid. And could you name some of them? So prednisolone, methyl prednisolone are the categories, are the medications coming in the categories. All right. So next we have anti-leukotrienes. So that category medication, we call it as leukotriene modifiers inhibitors or anti-leukotrienes. All right. So the example is Montelukast, Montecalci or Montelukast. You might have seen patients taken, and I personally have taken the medication due to the existing respiratory conditions, but not on a long term, but short time. Yes, I admit. So these are the medications of which the patients could be prescribed. It depends the duration. It depends on the onset and severity of the disease. That's why I say it's necessary to go ahead and check the drug study we have in the other playlist of this channel. All right. So back to the medications. The anti-leukotrienes example is Montelukast is prescribed for asthma, and also methyl santhas. Let me know in the comment if you know any of the drugs belonging to methyl santhins. But I'm gonna say a drug's name, which is theophylline. So you might have heard about theophylline, which is widely being used for the management of asthma. All right, so in the slide you can see all of these drugs. So these are used for the management. Apart from that, I would also say, can you think about the disease being severe? So in case of severe disease, the doctors could also prescribe oxygen for the patients, and also in severe conditions they could even go for intubation, that is invasive or non-invasive treatment. So invasive or non-invasive ventilation could also be happening in the medical management. So this is what is being discussed. I hope it's clear until here. Next, we go to the nursing management, which is the most important and the critical and the most needed one. So, since this channel is all about the how to study the nursing effectively, we give more importance to three of the slides, which is proceeding from here. So, in the nursing management, it depends on your nursing management depends on the severity of the patient and also severity of the disease. All right. So if it is a severe one, you could assess the doctors in intubation. If it is an invasive intubation, all right. And if it is again severe one, the doctors could prescribe the IV medication. So you could assist in carrying out the administrative procedures in the injection. All right. So that apart, let's talk about the general assessment that you make. So we have already discussed it's important to take the family history, economic, environmental, or the assessments of the patient. The assessments also includes a detailed vital signs that has a temperature, pulse, respiration, respiratory pattern, the respiratory sound, whether they have dyspnea, whether they have wheezing present. All right. So these are the crucial or the critical nursing assessment which you can do. And also, as we have already seen, emotional or fear or anxiety could be the trigger of the disease, or it could also worsen asthma. So you could, as a nurse, assist your patient in alleviating the fear and anxiety. And also important that if they need any assistance with the inhalation, or how to take nebulizations, or how to do the peak flow monitoring, you could be of great help to the patients by teaching them the correct medical management. So with that, in addition, it's also necessary that the nurse notes down the medic effect of the medication and how long it took, etc. So it's very important that you note all of them as well. At the same time, it's important to note if they develop any allergic reaction, or how do they respond to the medications, if there are any adverse reaction that you have observed or you have seen the patients being worsened. I have seen in a clinical condition where one of my patients were, but she was not obviously for asthma, but every time she takes 7% normal saline nebulization, which I think comes as a pulmocare, she cannot really tolerate that. So it was important as a nurse that I escalated it to the medical team and necessary actions were taken for it. So, as a nurse, if you come across any of these, it's important that you escalate to the doctors. So, identify the medications the patient is currently taking and administer medications as prescribed and monitor the patient's response to these medications. The medications may include an antibiotic. So, if your patient has an underlying respiratory infection, your medication management also includes IV antibiotic. And I think it was a nursing diagnosis of asthma video that we discussed about fluid administration if the patient is dehydrated. All right. So we need to look for doctor's orders if any fluids are prescribed for the patient, and also assist in the administration. So these are the nursing management for asthma. All right. Happy to go ahead. All right. So in community teaching, teach the patient and family about asthma. That is, about the chronic onset of the chronic nature of the disease, and how it is called as a inflammatory, what happens, the purpose and actions of the medication, the triggers to avoid when they have, and how to do so, what are the actions they could do to prevent the exposure, and also proper inhalation technique, which is very important. Instruct the patient and the family about the peak flow monitoring, maybe obtaining a record and noting it, and over the period of time, if they observe that the peak flow reading is decreasing, how to improve that, or how to reach for help if the peak flow reading is diminishing. So that means they could have an inflammatory disease, or they could have an impending or upcoming asthma episode. So if you could identify as a community nurse, it could be really helpful for the patient and family. All right. So these are important in the community teaching. Teach the patient how to implement an action plan and how and when to seek for assistance. Obtain the current educational materials for the patient based on patient's diagnosis, causative factors, educational level, and cultural background. So these are involved in the community teaching. So in a nutshell, I would say, to begin with your teaching, it's important that you obtain a detailed history as well as a detailed assessment. So once you have the baseline of your patient, the baseline of the family background, or everything of a patient, it's very easy for you and patient to work out on a common plan for the management and prevention of the disease. Make sure that they have adequate supply of medications that includes inhalers, peak flow meters, nebulizers, etc. at home, and also leave them with the address and the details of the community or the healthcare organization should they need to reach out if they have an attack, or if they have the feeling that they have an upcoming attack. All right. So that is what we have included in the community setting, and in the continuing care, we have the preventive measures is given a lot important. So it's important that you sit with the client, you sit with the patient, and make a plan to how to help your patient to identify the triggering factors, identify the precipitating factors, how to avoid them, what are actions to avoid, etc. And in case of patients having problems or issues or challenges with the house, it's important to educate them to how to keep your house clean, away from molds and any of the infestations, or talk about animal furs or anything coming as allergens, how to keep their household clean. All right. And also, as a community nurse, you could ensure that you pay a regular visit, or if you're a nurse working in the ward, you could recommend them, or recommend them to have the assistance of a community nurse. All right. And it's also not uncommon that we see them with the anonymous group or the community group. where they talk about their experiences, which could really be of great knowledge to the patients, because we as healthcare providers could provide the health education, but still could be limiting with the life experiences, whereas in the community group you have a living examples, and where they share so many treasures of information. So this could be included in the continuing care of asthma. All right. And also the family education is important, to make sure that you do that as well. All right. So yes, with this we have come to the end of the video. Well, I'm also feeling surprised that we managed to make a full video on asthma. I hope it was useful for you. Make sure that you go ahead and watch the video a couple of times, so that be thorough. And if you are a learner who is more of a kind of auditory, and you like to see a lot of visuals in the learning, make sure that you subscribe to our channel, because there are a lot more videos upcoming for the disease condition, for the drug study and the nursing management. So compared to you reading in a book, it could be okay for some people, but for some people it wouldn't be. You can resort to channels like this, so that you go ahead and watch one episode, and you feel more confident in attending the cases, or being a team member of a medical team assisting in patients fast recovery. All right. So I hope you are now feeling confident about the disease condition and the care for it. I hope you are ready to go ahead and shine in the clinicals. With that, we end the video. Make sure you subscribe to the channel for more learning, and also you share to your friends whom you think could be useful if they watch it as well. So with that, see you in the next video. Good luck.